Welcome back. Most of us familiar with minor aches and pains. A lot of us have us, especially in our back. But if you're struggling with persistent back pain and need to know whether or not you should actually go visit the doctor, then we've got the information for you today. Joining us now live via Google Plus is Dr. Dawn Waters. Hello, Dr. Waters. Thanks for being with us.
Hi, good afternoon.
Good afternoon. So a lot of people experience back pain, right? Something that's pretty common for a lot. But when do you know that you should actually go see a doctor about your back pain? What's the red flag?
Well, the things that you worry about beyond the usual aches and sprains are anytime that the back is causing nerve damage or there's structural instability. The things to look out for would be weakness, numbness, tingling in the arms and the legs. Especially if you have problems controlling your bowel or bladder, go to the doctor immediately. And then pain that actually goes beyond just the back pain down into your arms or your legs would be a reason to check that out.
And so you would consider those the red flags?
Oh, there are additional red flags. Those are sorts of signs of nerve injury, but there are other dangerous causes of back pain, such as cancer, a back infection, or a fracture. And so if you have any problems in your history, such as a history of cancer, some unexplained weight loss, any sorts of signs of infection like a fever, night sweats or chills, if you've been exposed to tuberculosis in the past or you come from an area where tuberculosis is common, recent IV drug use, old age, or if you've been in an accident and you've had back pain, you should probably get that checked out because it may be something a little bit more exotic than your usual back strains.
And what if you're not experiencing some of the red flags, but you still want some relief? You've got that persistent pain. Any suggestions for alleviating that pain?
Mm-hmm. The most important principle is to listen to your body. Is sort of the most basic thing that you do. We've evolved to avoid pain because pain is our signal naturally for injury. And so if you avoid pain, chances are you're not worsening your injury. Beyond that, ice and heat can be very helpful. They distract the nerves that cause pain and can relieve pain that way. But ice also reduces inflammation and swelling, and heat can relax the muscles. And so you can try either, see which works for you. Do ice packs or heat packs 20 minutes at a time, every 3 or 4 hours throughout the day. And that can sometimes provide some relief. Over-the-counter medications such as the acetaminophen, ibuprofen, naproxen, use those as directed, and just let your doctor know if you're planning on taking those with other types of medications or combining them, because they can be dangerous, but they're very safe when taken as directed. Keeping moving is an important principle. A lot of people think that they just need to lay down and not move around, but that can actually make the pain worse. So the more you're moving around, the easier it is to keep the pain under control.
To take care of it. A lot of great tips. Thank you so much for being with us. We appreciate it. And if you'd like more information, you can always find them online at stmarysreno.com. Appreciate it. All right, stay with us.